The Ebola outbreak that has killed more than 3,400 people in West Africa hit home for Americans this week. The deadly contagious virus that was, until now, an ocean away became a reality as U.S. authorities quarantined 4 people who were in contact with Liberian national Thomas Eric Duncan, the first reported Ebola case in the United States. Late Friday, top U.S. government officials briefed reporters at the White House to allay fears of a possible outbreak on American soil. Dr. Anthony Fauci of the U.S. National Institutes of Health drew contrasts between America's medical infrastructure and that of affected nations.
The reason we are having this devastating, painful, very difficult situation in the West African countries is because they don't have the system to be able to contain it. If they had the system, we would not be seeing all of this suffering and dying in West Africa.
U.S. officials also dismissed suggestions of a travel ban from source countries to the United States, pointing to measures in place at West African airports where dozens of people suspected of having Ebola have been stopped from boarding planes. White House Homeland Security Advisor Lisa Monaco said Friday a travel ban would actually impede the U.S. response to the outbreak in Africa.
The most important and effective thing we can do is to control the epidemic at its source. So what we want to be able to do is ensure we're getting the assistance, we're getting the expertise, and we're getting the providers into the affected region and not impeding that.
And on Friday, Pentagon spokesman Rear Admiral John Kirby updated reporters on the U.S. response in Liberia, with 230 American military personnel on the ground, 2 operational Ebola testing labs in place, and hospitals set to open this month.
All of these efforts are laying the groundwork for what will prove to be a significant increase in our troop presence and operational tempo on the ground in West Africa. We project that there could be nearly 4,000 troops deployed in support of this mission, but we're obviously assessing the requirements on a daily basis.
The help cannot come soon enough as the death toll continues to climb in West Africa. Aru Pande, VOA News, the White House.